Good morning, this is Dr. Bridget Solomba Malewezi. It has been a long time since I posted a video. I hope that you're all healthy and keeping well. Although we are at the tail end of our COVID third wave, that we're all staying safe and keeping ourselves healthy. Today I wanted to talk about a topic that is not COVID related, although it has had some impact, and certainly COVID has had some impact, and that's to do with mental health. This coming Sunday, the 10th of October, is World Mental Health Day. And in recent events locally have shown that a lot of us don't understand mental health, or that we shun or don't really take mental health as a key priority for ourselves. And so I wanted to talk about that because I think that especially now in the era of COVID, mental health has taken more prominence, that it is more important for us to take care of our mental health, even more so than before. So firstly, I wanted to address a key aspect that I think is important in understanding mental health per se. What I noted is a lot of people think that the word mental health is a dirty word, and there's a lot of stigma and discrimination, both for people who want to be helpful, but also from people who maybe just have a misunderstanding of what it entails. So firstly, just to say that health, what is health? Health is not merely the absence of disease, and that's a definition by WHO, the World Health Organization. It clearly defines that health is not just the absence of malaria or HIV or whatever other disease. It actually is a state of being well-being. And well-being is also defined not just in terms of your body, physical body, but also your mental health, your mind, that your mind and your soul, your spirit, needs to be in balance. So actually the definition of health by the World Health Organization encompasses physical, spiritual, and social well-being. And when we talk about your mental health, it's actually looking at the mind and soul aspect of your health in terms of your spiritual, social, and emotional well-being. And so it's important for someone to be able to be, if there's thinking that you want to be healthy, it's no point in exercising and eating healthy if your mind is not right, if your soul and your spirit is not right. Now, I know it sounds very preachy, but this is actually a health and scientific element. So again, just to really focus that a lot of people think that when people are talking about mental health that it's a weakness, but it's actually a matter of being healthy, that to be really truly healthy you must have all of those elements in balance. And so mental health, it looks at again, just to then move forward in terms of like, now that we understand that our health is body, mind, and soul, then how does mental health come into encompass? And again, it's about the balance of all of these aspects. It's about the way you think, both about yourself and your capacity. It's a way about you engage with other people. It's about coping with stress. So again, these three elements are important because it's not, I think a lot of people think that mental health is merely, we always just think of the people we see walking around on the streets, and we think, oh my gosh, that's mental illness. We'll also probably just think about people being sick and being admitted to mental hospitals, but that's not what mental health is about. It's actually about being well in your mind, in your soul and your spirit, and how you cope with other people, how you engaging with other people. And so again, I often hear people say man up, and I think even the recent events locally where a prominent member of society took their own life, people are like, oh, he should have coped, I've had death, or I've lost somebody. We all have different capacities, and it's important to realize that, because the same way not all of us can run a marathon or can pull weights or do some of the things that other people can do, it's similar. We're all not able, we don't have the same mental health capacity. That doesn't make anyone weaker, we're just different. I think that to also understand that mental illness in its essence is something that needs treatment, and so people should not shun from getting treatment just because they're worried about what it looks like, or because of the stigma that obviously is there currently, and we're hoping that that will reduce. It's important to realize that mental health is important. It's an illness. If you are not feeling well, you need help, and the type of help you need is is varied. You don't all need to be admitted. Sometimes counseling is all you need. Sometimes some medication is all you need. Again, the same way that when you have malaria, not all of us will get admitted to a hospital because of malaria. Some of us will just get our treatment and go back home. Some people need admission and other things, interventions. I often hear people sort of say things like, oh, I just toughen up, you're a man, you're a woman, I've had the same thing happen to me. But this is not right, because I want to give the analogy, and this is an important analogy I often give, is if someone had a broken leg, nobody would just tell them, just walk it out. Nobody would be like, if somebody had a broken leg, it's sticking out, they're bleeding, nobody would just be like, oh, you know what, just walk it out, it'll get better on its own. No one would ever say that to someone with a broken leg. We would try to see how to help them. We would carry them. We would get them crutches. They might need surgery. The same way that somebody with mental illness will need some sort of intervention. And it's not fair or right to just say man up. Again, there are resources locally that can help somebody cope with the stresses that they have, and it's not a sign of weakness to request for help, to seek help. And again, depending on your own capacity or your need, you don't need to tell everybody, you don't need to advertise to the whole world your particular issues. Again, because as medical people, we are have the code of ethics that requires us to keep your privacy and confidentiality, but you do need to seek the help. So again, I know that there's a number of helplines that are available. There are hospitals and resources, counselors, a range of supportive services that are being built up for mental health. It's an important aspect. So as we commemorate this day coming up on the 10th of October, I'd like to encourage all of us to reflect on our mental health. If you're struggling, both whether it's work, family, if you're feeling unengaged, again, because even in this era of COVID, we're seeing that people are feeling detached and unconnected. They're feeling, people have lost their income or their connectedness to people or their jobs, and a lot of others have lost friends, family, and colleagues. These things have had an impact on our mental health. We cannot pretend to feel fine, and again, that means we're not healthy. We need to be able to get the kind of help that is required. So I would like to strongly encourage and really get everybody to really think about their mental health this coming Sunday. Take action for yourself, for you to be fully healthy, body, mind, and soul. Thank you, and continue to seek information and get information from credible sources. Thanks.